Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Alberta Infant Motor Scale assesses gross motor maturation in infants from birth through 18 months of age. It evaluates motor skills across 4 positions: prone, supine, sitting, and standing. The scale measures weight-bearing, posture, and anti-gravity movements critical for typical neuromotor development. Its main purpose is to identify motor delays or abnormalities early, allowing timely intervention for conditions such as cerebral palsy, developmental coordination disorder, and other neuromuscular impairments. The tool is standardized, reliable, and validated for clinical and research settings to monitor motor development milestones objectively. The Alberta Infant Motor Scale is indicated for infants from birth to 18 months of age. It is specifically validated for use with both typically developing infants and those at risk for motor delays. This includes populations such as preterm infants, infants with low birth weight, and those with neurological or developmental impairments. The scale is most useful in clinical contexts involving early detection of motor development abnormalities, monitoring motor progress, and guiding intervention planning. Its application is prominent in outpatient rehabilitation settings, neonatal follow-up clinics, and pediatric neurology evaluations. The Alberta Infant Motor Scale consists of 41 items divided into 4 positions: prone, supine, sitting, and standing. Each item evaluates specific motor skills, such as head control, rolling, crawling, and standing. The assessor observes the infant's spontaneous motor performance during a structured session lasting approximately 20 to 30 minutes. Responses are scored as observed or not observed, with no partial credit. The examiner marks the most advanced motor skill attained in each position. Raw scores are calculated by summing the number of demonstrated items. These raw scores are then converted to percentile ranks based on normative data stratified by infant age in weeks. Percentile ranks below the 5th percentile suggest significant motor delay, while scores between the 5th and 25th percentile indicate mild to moderate delay. Scores above the 25th percentile generally reflect typical motor development. The scale is appropriate for infants from birth to 18 months corrected age. Interpretation should consider the infant's corrected age and clinical context for accurate developmental assessment. The Alberta Infant Motor Scale demonstrates a sensitivity ranging from 85% to 95% in detecting motor delays in infants up to 18 months of age. Sensitivity refers to the tool's ability to correctly identify infants who truly have motor impairments. In clinical practice, a sensitivity of 90% means that 90 out of 100 infants with motor delay will be correctly identified by the scale. Specificity for the Alberta Infant Motor Scale varies between 75% and 85%, indicating the proportion of infants without motor delays who are accurately classified as typical movers. Specificity reflects the test's capacity to minimize false positive results, thereby reducing unnecessary interventions for infants developing typically. High sensitivity ensures early detection and intervention for affected infants, while adequate specificity prevents misclassification of normal development. These values support the Alberta Infant Motor Scale as a reliable screening instrument in pediatric motor assessment. The Alberta Infant Motor Scale was developed in the early 1990s by Piper and Dara to provide a norm-referenced assessment tool for evaluating motor development in infants from birth to 18 months of age. Its validation process involved longitudinal studies of healthy infants across diverse populations to establish normative percentile ranks and motor milestones. Subsequent research by Piper and Dara and colleagues demonstrated high inter-rater reliability, with intra-class correlation coefficients exceeding 0.95 and test-retest reliability estimates similarly above 0.9. Construct validity was supported through correlations with other established motor assessments, such as the Peabody Developmental Motor Scales. Additionally, studies involving at-risk populations, including premature and neurologically impaired infants, confirmed the scale's sensitivity in detecting delayed motor development, with sensitivity values reported between 85% and 90% in various cohorts. Cross-cultural validations have further confirmed the scale's applicability internationally, adjusting normative data where necessary to account for population differences. Collectively, this body of empirical evidence substantiates the Alberta Infant Motor Scale as a reliable and valid instrument for early motor function screening and assessment. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.